Good evening, everybody. My name is Dr. Gigi El-Bayoumi from the Rodham Institute, and I'd like to welcome you to the Rodham Institute's Impact Speaker Series. Today, we're going to hear from some experts about the cost of living, tenant and landlord rights during COVID-19. But first, I'd like to give you an update on the status of COVID here in the District of Columbia. Really, we've been quite lucky in that we actually have been following the CDC guidelines and the evidence-based regulations and rules about how to reopen. So we've been actually having a decrease in cases. That's why we were able to reopen DC in phase 2. That means that how infectious people are to each other, we're not spreading that much because people are adhering to the physical distancing, to the hand washing, and to the mask covering. And I just want to tell you that here's a statistic that I came across that I think might be very helpful. If a person who has COVID is wearing a mask and is interacting with somebody who does not have COVID and is also wearing the mask, we can reduce the transmission to 1.5%. So wearing masks make a difference. If neither one of them are wearing masks, that transmission goes to 70%. So it is a significant difference to use the mask. Now, I know it's summertime. Nobody likes to be hot. It is very hard to breathe with the masks. But given that we don't have a treatment, given that we don't have the vaccine, this is all we've got right now, and it's life-saving. So I'd like to also give you some updates. I'm going to ask for the next slide, please, to remind you that what the Rodham Institute is all about. I established it 7 years ago. It is all about improving health equity in Washington, D.C., to improve the health outcomes and the lives of people in all of the District of Columbia. Now, our motto is that health equity equals social justice equals economic justice equals legal justice. These are all interconnected. It is one struggle and many fronts. Our 3 priority areas are youth education, programming, and workforce development. And I'd really like to invite you to go to our website so you can learn a little bit more, but it's really programming for middle, high school, and beyond to get kids to graduate from high school, because just graduating from high school adds 10 years of life to life expectancy. Training the current and future healthcare professionals in the social determinants of health and applied health equity. We know that there is all kinds of implicit and explicit bias in our healthcare systems, and we want to be part of the solution. And finally, community collaborations such as this to really join hands with the over 100 partners that we have to bring up topics and educate on a variety of issues, whatever the community would like, but also to stand with the community, for example, during this very trying time. We have delivered 2,000 meals to our friends and our partners in Southeast. We've also delivered, I think we're going on the second batch of 1,000 masks. And we've been holding these webinars 2 to 3 times a week since the beginning of the COVID crisis. We actually had them in person, but then we switched to a webinar. So again, I'd invite you to go to our website, because there you'll get some COVID resources. And of course, we have the key things that people ask us about, including food, mental health, school, testing. We update those. And if you are a member of a organization where you feel that you would like to have your resources listed, please just send us an email and we'll update our list. Here are all the various handles of our social media outreach, and we are very active on that. We also promote other wonderful work that's being done. So if you've got an event or something that you want to tweet out, please send it to us and we'll retweet it. And there are different ways that you can get involved. I think that sometimes we think when we're battling health inequities or racism or any topic that has to do with social justice, we tend to think of big gestures. But the reality is, if we just educate ourselves and make multiple small gestures, and where many of us working together, I think that we can move the needle. So sign up for our webinars, sign up and get involved. And I want to just thank our Rodham Institute intern, Ms. Zaina Houri, and future medical students who is just wonderful in setting this up. I want to acknowledge our 3 wonderful staff, Ms. Tracy Bass, the Director of the Health and Workforce Pipeline Programs, Ms. Christina Williams, the Director of Community Engagement. She's been a powerhouse in meal delivery and in mask delivery. And Ms. Ashanti Carter, Program Manager, who has really been instrumental in setting up these webinars and updating our website. They're all just a terrific team, and I feel very lucky to work with them. So without further ado, it gives me great pleasure to introduce our esteemed panelists for this evening's webinar. First of all, I'd like to start off with Dr. Reverend Kendrick Curry. Dr. Curry is a pastor and serves as a senior pastor of our beloved Pennsylvania Avenue Baptist Church, and he's done that for the last 16 years. He earned his BS in chemical engineering from Prairie View A&M University in Texas, and close to my heart, an MS and PhD in chemical engineering from the University of Michigan in Ann Arbor. He subsequently earned a Master of Divinity from Virginia Union University in Richmond and has completed advanced studies at Northern Theological Seminary near Chicago and Virginia Theological Seminary in Alexandria. Pastor Curry has completed direct action organizing training through the Midwest Academy of Chicago. He also serves on several boards of directors and participates in advocacy groups in health, education, and senior adult issues. He is happily married to the beautiful Reverend Karen Curry and father to Kiona and Kendrick II. Welcome, Dr. Curry. Next, I'd like to introduce Ms. Blair Gilbert. She is a staff attorney in the Housing Law Unit. She represents low-income tenants in eviction cases before the DC Superior Court. She also litigates housing law claims before administration bodies such as the DC Housing Authority and the Office of Administrative Hearings, and represents tenants associations in tenant opportunity to purchase act matters. Prior to joining Legal Aid in July 2017, she was a legal fellow in the Office of Legal Affairs at Legal Services Corporation. Prior to that, she clerked for the Honorable Phyllis D. Thompson of the District of Columbia Court of Appeals. Ms. Blair received her BA from Georgetown and her JD cum laude from Georgetown University Law Center. While in law school, she worked as an intern at the DC Council, the Access to Justice Initiative at the Department of Justice, DC, Appleseed, and Legal Aid. Prior to law school, Blair served as a Peace Corps volunteer in the Kingdom of Tonga. So I'd like to welcome you both. It is such a pleasure to have you with us. And I'd like to sort of jump right in. And so are you both there? I think you can unmute and please turn on your videos so that we can see you. You there?
Yes, hello.
Great.
Hi. Thank you for having us.
Hi, how are you, Dr. Reverend Curry?
Doing fine, thank you.
Good. Ms. Blair, are you there?
Yes, I am. Can you hear me?
Yes, I can. Well,
Great.
let's just jump right into it. Actually, today, I was talking with a resident at Brooklyn Manor in Ward 4. As you probably are aware, there's a lot of changes in that neighborhood, a lot of gentrification. And she was voicing big concerns about tenants' rights. First, basic rights, which were only been augmented with COVID. The landlord not keeping up with the various codes that are required, whether it is, keeping up with cleaning the vents, sort of essentially, I don't want to say threatening because I don't want to misalign or misrepresent, but people don't feel secure that they're going to have housing. Now, from a medical or health equity standpoint, I'll just frame this and then I would love to hear your comments. People say, well, what is a doctor talking about housing for? Well, as we know, the social determinants of health, which include housing, environmental, exposures, water, education, food, economic development of the place in which you live, work, and play absolutely impacts your health and life expectancy. Matter of fact, 80% of your life expectancy is accountable and is really from these social determinants of health. Only 20% actually has to do with whether you see a doctor or not. And specifically in the example that I just gave you, imagine that a person's got really bad asthma and the person, it's summertime and the vents haven't, filters, I don't mean the vents, the filters have not been cleared and there's, mold and all kinds of things that are in there. Well, what happens? The person gets sick, they land in the emergency department, and these days there's a concern about catching COVID. And then they go back after they've been in the emergency department and possibly in the hospital and treated. And what happens? They go back to the home where it's the same exposure and really nothing has changed. So that's just framing the conversation. So I guess we'll start off with you, Miss Blair. You're the attorney here. And we want to learn more about, in general, what are the rights of people? What are the rights of the tenants and landlords too, for that matter? But can you give us a sort of a 30,000 foot view of people's rights here in the District of Columbia?
Absolutely. And I'll focus this on your points about making sure tenants have safe and stable and healthy housing. You're absolutely right that tenants have these rights to expect the landlord to provide this kind of housing. And if the landlord falls short in providing tenants with this kind of safe and healthy housing, tenants have several options. They can, depending on how severe the problems are, they can ask the court for an order requiring the landlord to make emergency repairs. So the example that we often see in the summer could be there's a leak in the house. If the leak's not cleaned up, it will turn into mold. It will become a big issue that affects the tenant's health. But if the landlord's refusing to do it, if they know that there's a problem, but the landlord doesn't fix it in a timely way, the tenant can go to court and ask the judge to make the landlord do that. And if the landlord doesn't do it at that time, then the tenant can escalate it and ask for sanctions, ask for money against the landlord. That's for really extreme issues. A lot of times we see just some back and forth that the landlord just doesn't agree to make it a repair, but it's not something that is so extreme that's in your face, tangible housing code violation. Instead, it's something that's a little bit more on the back burner, but it's always there. Like mice are always in the apartment, or there are cockroaches always in the apartment, and maybe there are extermination treatments, but they're not really getting the job done. So sometimes tenants organize rent strikes. There are certainly risks involved in that, and if someone's facing a serious housing code violation like that, and they're considering withholding rent from the landlord, we invite that person to contact our office, and we can talk about all the legal options. But some tenants try to use money as an incentive to the landlord to say, I'm not going to pay rent until you fix these things that you're required to fix under law. So tenants certainly do have rights, and there are different ways to get the landlords to take action as required by the law. But again, like I said, we invite tenants to contact us if they're facing housing code violations. If the landlord's not complying with keeping the home safe and healthy, we invite tenants to contact the Legal Aid Society of the District of Columbia. And I'm going to share our tenant hotline number if I can, so that anyone, if anyone who's listening now or knows somebody else, if they have these kinds of issues, please contact us and we can talk through some options. So the phone number is 202-851-3388. And I might say that again later because it's such an important issue, especially right now with coronavirus. Lots of tenants don't know where to turn, and we want to make sure the tenants have someone to talk to think about these issues, because as you say, it's critical to the health of DC residents to be able to have healthy, stable homes. Thank
you. Actually, what we'll do is we will post that on our website. We'll tweet it out as well. We'll include it in the webinar that this is recorded, and it'll be on our website. So I think, the other aspect is that when you come from an under-resourced community, and let's say that you're living in an intergenerational home, you may not have people that are, maybe they've lost their jobs given the COVID. You're also worried about COVID. Maybe, meals become an issue and health issues. It becomes just one more thing that people have to deal with. And, the competing priorities is what I always talk about. So, Dr. Reverend Curry, I'm going to kind of ask you to chime in. You've got congregants that are older and may have some of the special challenges that I just mentioned. What are you seeing in your community and your congregants?
So thank you so much, Gigi, for this opportunity, and thank you for your comments. You and Attorney Gilbert already are on it. You are articulating exactly what those in the community as well as my congregation will experience. I can think about your one statement that is, I think, shocking that the audience needs to hear, and that's the 80% of our social determinants of health really sort of dictate a person's living, moving, and being. And that's incredible because we have those who live in places that are rat infested, those who have allergies as well as asthma, but the ducts are not clean. Those that don't have adequate cleaning, even in the corridors before entering the residences. So you have all of the dust, all of the things that are there, and they're living in really unsafe conditions. I've seen many folk who live in such conditions, and it is not aimed at health. And the beauty of all of this is if we look at the linkages that were noted between health equity, social justice, etc., then we began to understand that all of these things are linked. And so now we have opportunity to begin to resolve some of the problems rather than looking at them in silos, looking at some root causes and begin to pull some things apart. I'm also very curious and want to know even more about what we're doing because safe housing is critical to what my parishioners and those in the community really need. We do have a lot of homeowners, but we also have a number of renters. And this whole idea of a cost of living is really unjust when you're talking about folk that are underemployed or unemployed, and it's higher east of the river than it is in anywhere else in the city. So we are definitely experiencing that sort of injustice and disparity.
hmm So I want to step back because you mentioned homeowners in Ward 7, because people tend not to think of people living in Ward 7 and 8 as homeowners, but I just want to kind of educate the audience.
Sure.
Ward 7 is almost like it's two separate wards. You have retired federal workers who have been working, for the federal government and made a good living and were homeowners. Now, some of the families are ending up selling their homes or I should say, their kids or grandkids. So the home ownership in Ward 7 has actually gone down. And please correct me if I'm wrong. Other parts of Ward 7 are much more like Ward 8. So, and we know that Ward 8, things like the income of the average family income is about $35,000 for a family of four. So, so there, your particular congregation may have different kinds of challenges. Is that right?
Yeah, you're absolutely right. But one of the things that you know about Ward 7 in general, yes, we do have the retired workers. We have doctors, lawyers, physicians, and others who live in various parts of the ward. But the ward is very much one of a tale of two wards. There are those that have great means, and there are those that have little in terms of means. But one of the things I think that we have to be very clear about is how do we have a city where all folk have rights to live where they desire to live within their means? And that's a huge issue because we don't even know what affordable housing really means. It has a definition that seems to be one that moves about to and fro, and we're trying to get at it. And so we're going to need much more in terms of legal assistance, in terms of help, and in terms of resources to spur entrepreneurship, create jobs, have folk with living wages, so that then we can move from total rental, if one chooses, to home ownership. And I
Mhm.
would like to say that at one point in time, Ward 7 and Ward 8 had among the most affluent in the city. Then
Mhm.
after the 68 riots, etc., folk moved out and moved on, and other elements, other people came in, and then after a while, they moved on. And then
Mhm.
you find others who have found themselves literally just coming in and just only renting from those whose great grandparents lived in Ward 7 and 8.
Mhm. So let's turn to you, Attorney Blair, because Pastor Curry brought up a really important point. And I have to tell you, it took me a while to understand what affordable housing is. What is affordable housing? And who qualifies for it?
Generally speaking, the definition for affordable housing is 30% of someone's income. So if you think about, how much income somebody has every month, about 30% or less of that contributed towards rent is quote unquote affordable. It's the definition of affordable. Unfortunately, in DC, I think the number is 20% of people. Excuse me, I'm going to say these wrong, but there is a huge rent burden. I don't want to throw out a statistic only to be fact checked later, but there's a huge proportion of DC residents who don't meet that standard. They're paying half of their income instead of 30% towards housing, and I think it is a lot of the rising rents. It just becomes a very difficult position for a lot of long-term DC residents to afford to meet the definition of affordable, to find housing that meets that standard in relation to their income. Another big movement, another big movement that's really important right now is making sure that the rent increases don't exceed what's reasonable for people to pay. So rent control expires, the legislation relating to rent control expires this year. And so a big element to making sure DC is affordable long-term is to make sure that rent control is protected and expanded so that people aren't continually squeezed out of homes when the cost of living just exceeds what people are able to pay.
Mhm. So tell us, during the era of COVID, we understand that both at the local and federal level, there have been suspensions of evictions. Can you talk more about that, and how long will they last for?
Yes, this is a great question. There are no new eviction cases that are permitted to be filed for the duration of the public health emergency, plus 60 days. So right now, the public health emergency is scheduled to expire July 24th. And then that means that plus 60 days, the first eviction cases could be filed after September 22nd. There are a number of other great protections in the laws that the DC Council has passed so far too, and I just want to point out a few of them to make sure people are aware of the rights that they have. If someone before coronavirus was in court, in landlord and tenant court, and received a judgment against them, meaning that the landlord had the right to execute an eviction, those evictions have been postponed, and the first date that they can be rescheduled for is August 15th. So people have a little bit more time also if they already went through the court process, faced a negative outcome. They still have until at least August 14th, August 15th. And I say these, if the mayor extends the public health emergency, some of these dates could also change. There are no rent increases for 30 days after the end of the public health emergency also. So tenants are required to continue to pay rent at this time. If someone can pay rent, they should pay it, but the landlord can't charge more than the current rent level. And finally, another big one is that the DC Council's prohibited late fees during the public health emergency. So if someone is able to catch up and pay just after the date that the rent was actually due, tenants have more time under the law. And also, landlords are required to give tenants a repayment plan so that tenants who could not pay because of coronavirus, they have more time to get back to work, to hopefully start to make some of that money back. If someone is facing that situation, if they have lost their job or loss of income because of coronavirus, we invite them to contact us to make sure that they can talk through all of their potential rights and leave no stone unturned to make sure that there aren't any other issue areas that we could help them with.
Oh, thank you. We've also been hearing about self-eviction. Can you talk about that term? I had never heard of it before.
Yes. In DC, there are no self-help evictions. That means a landlord has to go through the court process to evict a tenant. A landlord cannot change the locks because someone is late on rent. They cannot shut off utilities because they want the tenant out of there. DC protects tenants and requires evictions to happen through the court process. And at those times, tenants can raise a number of defenses. Another protection for tenants in DC is a landlord has to have a reason to want to evict somebody. A landlord can't say, the lease is up, I'm changing your locks, you have to get out. That's absolutely illegal. If this is happening to folks, we hope they contact us because what we see a lot during coronavirus, tenants are unable to pay rent. Landlords say, you need to pay rent now or I'm changing your locks. And it's a very stressful situation. If for some reason someone gets locked out, they can call the police to get them to be reinstated immediately to the tenancy, or they can contact our office and we can see if we can help get the court involved to order the landlord to make sure that that apartment or that house is accessible. But there are no self-help evictions in DC. There has to be a court process. But as we've talked about, the court process isn't really proceeding right now. That's one of the protections for tenants during coronavirus also. No new court cases are being filed. The court cases that are in existence right now are all basically being postponed. If someone has questions, if somebody has an eviction court case going on right now, again, we invite them to contact us and we can look into it more for them to see what the status is. But in the meantime, nobody's landlord can just try to kick them out.
Yeah, unfortunately, we've heard of cases where they have done that. I think one of the reasons that we're having this webinar is to educate people. Reverend Curry, have you heard of this in your community?
Personally, I don't know of anyone that's been kicked out directly. I have in my community, but I have heard of others that I know that have been kicked out. And one of the challenges that we face is when landlords and others are really engaged in dealing with the coronavirus and as well as trying to run a business, if you will, in terms of collecting rent, they oftentimes are putting undue pressure on those who do not have the resources and the means. And as such, these who may not be as savvy as some others don't necessarily know to go to the attorneys or where to go or what to do or how to do it. And so they're actually led by their those who are the landlords, and they're finding themselves caught up in situations, and that's just horrible. That people seem to be misleading and mistreating, and so I think it's very helpful that you have some form of legal aid available to you, and to get this information. Not everyone is going to read, the Office of the Tenant Advocate, that COVID-19 state of emergency tenants' rights and resource document. And even if they do read it, then how do you begin to interpret it, right? And what do you need to do? And so as we were just talking, I just heard that, if it's 30% of your rent divided by roughly your total income defines affordable housing, but in DC, you're spending nearly 50%, folk are making some hard decisions.
Yes.
And the challenge is, if I'm underemployed or unemployed, then I find myself really in a quandary here. I'm between a literal rock and a hard place. And
Yes.
that's economic injustice, because
Yes.
I've found myself in a situation where the system is broken, and as a result, I'm broken, and everybody just sort of discards me as a discarded person. That says I don't have worth and dignity and value. And that's exactly the wrong direction that we need to be moving in. We need to affirm people that were created in the image and likeness of God, that have worth, value, and dignity. And so I'm just grateful for what we're trying to do, because this whole idea of cost of living is really costing those who are on the margins of society.
Wow. Preach, Reverend. That's exactly right. And, there are so many interrelated aspects. Earlier today, I was talking to my good friend, Ms. Cora Berry,
Mhm.
as well as Ms. Elliott, who is from Brooklyn Manor. And we were talking about the digital divide, and how the kids that are in the Brooklyn Manor don't have internet, and that impacts their ability to get educated, certainly with a lot of things now on telehealth, if you don't have a computer, a smartphone. So it's a bundled issue, right? And so if people are making those decisions between paying the rent, getting food on the table and getting the internet, we know which one is going to fall off. So, obviously not all landlords, it's like a few, right? Usually in any issue, 90% of people are great and 10% cause 90% of the problems, right? I'm
Sure.
sure that there are lots and lots of good landlords who are ethical and who do everything. But Attorney Blair, are there hotspots, pockets, and how can we support the community members in those hotspots through advocacy, through education, through whatever support that they may, that they may need?
Reverend Curry made the point that there are lots of people who are kind of taken advantage of by the system. The landlord takes advantage of certain populations. And one group that we really see that happen a lot too is our immigrant population, people who might not be documented, who have other reasons to fear for their health and safety. So when a landlord makes, even if they're bogus threats, they make some kind of threats to the legal status of someone. We see those as a hot spot of people who often end up getting the brunt of a bad landlord. There are also other people when the landlords think that tenants aren't connected with a strong community or a strong access to legal aid, which is another reason this program is so wonderful, to make sure you'd made the point of a community collaboration. This is why it's important to make sure that tenants know their rights so they can stand up for them. And sometimes it's scary to do it yourself. Even if you read OTA's guidance, what does it actually mean? Please do contact a legal aid organization. Legal Aid Society, my organization, is not the only one in DC. There are a number of other places that offer free legal services. So it's anytime a landlord thinks that they can take advantage of someone, those are the hot spots. And how do we overcome this? It's through programs like this. It's making sure that we are well informed ourselves and getting the word out to make sure that tenants know they don't have to leave right now. If they don't have access to critical services, they can get in touch with a lawyer. There are lots of court processes that are designed to be able to be navigated without legal assistance. But in coronavirus, that sometimes is even more difficult because somebody needs to call into a hearing. Sometimes the legal system can just be a black box. So we hope people will connect to the leaders of communities and that those communities can put people in touch with us and other legal services providers.
So just to tell you that the Rodham Institute is a member of the DC Healthy Housing Collaborative. We had a meeting yesterday, and there are lots of people, from pediatricians to lawyers to all kinds of activists that are connected through the city. And then there's another wonderful medical legal partnership. This is actually a national organization, and its headquarters are housed at the GW School of Public Health. So let's say that I have a patient and they're telling me that there's all this mold. I mean, I, as a doctor, you go to law school, right, to learn these things. So I pick up the phone and call my friend, Mr. Joel Tattlebaum, attorney Teitelbaum, who's he runs the Medical Legal Center. And he says, okay, we're going to be the ones that are actually going to take the landlord to court, or at least try to work with them initially, and then if they don't. So it is about education, because there are actually a lot of resources and a lot of good people, whether they're students or law or public health or medical or whatever, that want to support them. But I think, Attorney Blair, you brought up a really important point. I don't know that necessarily our leaders who are in the community, of course, absent Reverend Curry, necessarily know this information, or it even necessarily even rises to the point of attention, because people are dealing with so many other things. So Reverend Curry, can you speak to that? Because you're an incredible leader. And what sort of is your sense of how, is this issue kind of making it, does it rise to the top of priorities in caring for community members from your standpoint?
Well, let me say this. The answer to your question is yes, it does. Because really what we're trying to address is what a whole person needs, right? You need food, shelter, clothing, I mean, basic needs. And one of the things that is really a hallmark for us is I believe in trying to get as much information out to the community as possible, and that can happen by any means necessary. But I also engage in partners and partnering with others so that we can go deeper into some of those untapped and untouched areas that we find in our community. So I not only try to give you information, but I try to seek to help you to get information so that we can have some alignment with regard to what we're trying to do. Because if we don't, then everything we've discussed, all of the resources we've talked about, won't amount to much because people will not hear. And to go even further to help folk get information, we make sure that at our church, Pennsylvania Avenue Baptist, literally, that we're trying to get folk to have seminars, webinars, et cetera, et cetera, et cetera, to try to get you the information. One of the ways we're even doing that right now, we're in the midst of a COVID pandemic, and there are very few churches, if any, besides ours, that are literally testing for the virus.
Mm-hmm.
And so I'm going like one would and Paul Revere would literally say, I'm saying the COVID is coming, the COVID is coming.
Mm-hmm. Mm-hmm.
So until we say it loud, we need more PSAs. We need more television ads. We need to
Mm-hmm.
pay close attention. I love what the mayor's done with the television ads, by the way.
Mm-hmm.
We need more of that. And when we
Mm-hmm.
get more of that, we will be able to share the community. And
Mm-hmm.
I will close this portion by just saying social media is the way we got to reach those who are the most infected in the 20s and 30s that are rising with COVID-19. And I just say that because those are also the ones that could take it home to grandma and others with
Yep.
the kids, and those below will take it home to grandma. Next thing you know, we're in a world of trouble. And then we have things in throughout our buildings.
Right.
And that's just not helpful. It's just
Right.
not helpful.
Well, I mean, and thank you, Reverend. And all this relates actually to housing. I mean, I have
Right.
one of the people that I work right alongside with at GW seeing patients, and she lives in a small apartment with her 70-something-year-old mother and 90-something-year-old grandmother. She is the only breadwinner. So if something happens to her, that's three people that get sick. But
Mhm.
I wanted to bring up why the importance of housing and environment. There was actually just a study that was published that shows that environmental pollution, which of course includes the home, right, and your environment, your neighborhood, actually has a really negative effect on the outcomes of babies born to Black and Latino women. So these are not just theoretical. It's not just, oh, well, you're just complaining because you don't want to, you want to fancy your house or whatever. Furthermore, the impact on COVID, you see what is to me very offensive is when you see these movie stars talking about how hard it is for them to be quarantined, and they've got these huge mansions, right? And talking about physical distancing. But all kidding aside, the home environment is so key. And I'll just give you one example before I move on. We had a community health connect, which we have at Busboys and Poets. Of course, we can't do that now. And we had people, it was about how housing impacts public health. So one of the pediatricians was telling us that she takes care of kids with asthma, bad asthma. That the mother said that her 5-year-old came and said, "Mommy, mommy, there are mushrooms growing on the wall."
Mhm.
Mushrooms growing on the wall. Or when they would bring in the nebulizer treatments, there would be like cockroaches all over. I mean, to me, that is criminal that, children, families, but Reverend Curry, I wonder if you could talk about the elderly. I know that you've got a
Yeah.
lot of older folks in your congregation. How
Yeah.
are they managing?
Yeah, it's tough for the elderly, particularly if you don't have resources. Clearly, there's a distinct difference between the haves and the have-nots. Those that are fairly well off are faring well. Those
Mhm.
that don't have the resources, they're suffering from social isolation. They're suffering in their homes because they're making decisions of medication over paying rent.
Mhm.
And so we're really seeing a number of folk, and one of the ways we measure that of the challenge is just how much food we're distributing now. Just yesterday, we distributed over 36,000 pounds of food
Oh my
with our
goodness.
partners. That's just on Monday, and it was full meals, and it was, while it was for everybody, you see so many different seniors having anyone they can come to the church and drive through. We had a drive through system and pick up food, and I'm like, oh my goodness, what if we're not here? And then I think about their utilities. Do they have the gas to cook? Do they have the electricity to do? So seniors right now are among the most vulnerable population that we can even deal with in terms from a housing standpoint, as well as this coronavirus. And they are ones that are often overlooked. And my even greater concern is, even when the mayor's order is lifted and the rent comes due for all of the back rent, and even if you have a plan, how in the world will they be able to cover what's necessary so that they have decent and affordable living?
Mm, yes. So, Attorney Blair, when you are working with people who just don't have the means, do you sort of refer them to resources which can help cover the rent? And can you tell us what those resources are?
Thank you for this question. This is great. This is more information sharing. If someone can't pay their rent right now, like I said, tenants are entitled to a repayment plan. So if they anticipate being able to pay rent in the future, that could be a reason to continue to stay in the home and fight for your apartment or your house. Or if there are severe housing code violations, like we said, if there's serious mold, if there are cockroaches, if there's the stove hasn't been working in years, there was no heat in the winter. These are all factors that we would like to talk with someone. But maybe even if they don't have the money to pay right now, maybe this would reduce the balance that they would owe overall. But it's something worth working with us more one-on-one to consider. There are also a number of other organizations. There's the Emergency Rental Assistance Program. It's a longstanding DC government program that helps low-income tenants, low-income renters, connect with financial resources to help pay that back balance. The pots of money for the ERAP program have been expanded during the coronavirus pandemic. And so we invite people to contact us. We also have a link on our website. The website is legalaidgc.org. And if you're looking at the webpage, on the right-hand side, there's a coronavirus section with a resource guide. So this has specific resources of where you can apply. You can also contact us, and we would hopefully be able to connect you with the right resources. But one thing that's come up a number of times too is about people who have lost wages. And people who were employed are often entitled to unemployment assistance, either through the traditional public unemployment insurance program or through one of the new programs that was created because of coronavirus. Legal Aid also has attorneys who work with people who are trying to apply or who have been denied from these kinds of programs too. So again, we invite people to contact us if they're having issues accessing financial resources. You know, if they're having problems with unemployment insurance, the PUA assistance that was created for the pandemic, if they have trouble getting their SNAP benefits, TANF, whatever it is, we have a unit that helps with that too. So if people are having problems, hopefully they can contact us. And two more other areas that we work on, because we're talking about how do people meet their basic needs. Legal aid works with people to help make sure they meet those basic needs. We also have a family unit. So if someone's experiencing domestic violence, if they're having issues with custody, if they're having problems like that, hopefully they can contact us and they can talk with an attorney about their options there. And we have a consumer unit. There are lots of homeowners who are facing foreclosure. We represent homeowners in those situations, and we want to make sure that people are connected with those resources. We also help people who are facing credit card debt and somebody's trying to collect on that. So there are a host of options. Sometimes people think that there's not quite a legal issue there. If there's something that sounds kind of familiar, please reach out to us. We have an online application, or people can call. Our offices are closed, but our phone lines are open, and our website is too.
Thank you. You know, during this whole conversation, we haven't mentioned the G word, which is gentrification. And how has gentrification, because I mean, a lot of people, you know, here you have several generation Washingtonians who have helped to build this city, and all of a sudden they feel alienated and being, you know, sort of pushed out. How is that really impacting what you're seeing in terms of the number of complaints? I mean, do you feel that there is almost like a focused effort to get people out?
Is that directed to me or Representative
Yes,
Curry? Do you?
yes.
Oh,
No, I'm
okay. Sorry.
talking to you, yeah.
Absolutely, there is an effort to push people out. This is something that we've seen for years, that landlords are looking to essentially squeeze tenants out of buildings by either not making repairs or trying to buy people out or jacking up the rent to really high amounts as a tactic to get a vacant building that they can then sell, and someone can flip it and turn it into what they consider more lucrative housing. And legal aid works with individual tenant associations, you know, for particular buildings, sometimes to try to get broader relief for those individuals. So we also have a policy branch that works with the DC Council to try to you know, create a more comprehensive legislative approach to make sure that doesn't happen, so that long-term DC residents aren't squeezed out.
Mm-hmm.
Yeah.
Thank you. Reverend Curry, you know, we talk about racism with a big R. What is your take about how this actually represents racism?
Well, gentrification and racism go hand in hand. Anytime you discriminate, anytime you have prejudice, bias against anyone with regard to the color of their skin as well as their economic resources, you're talking about racism, classism, and all of the other isms that are very vile and not really helpful in our society. And I just want to say that in this season where we're having a virus or a pandemic, but at the same time, we're finding that folk cannot pay. It's fertile ground for the systemic racism in our nation, because what happens is people now start to find other ways and other means of survival of the fittest, their own social Darwinism, to the
Mm-hmm.
degree to which they find themselves saying, okay, how do I survive? But their survival is at the expense of someone else. So what they do is find themselves really beginning to move others out and just preserving for them and their families. And we see it time and time again. And we're going to continue to see it. And it becomes part of a systemic issue that says that at the end of the day, if I allow the system to have policies and what have you that are aimed at making sure that those who develop properties, those who have resources are able to have greater access than those who do not, we will continue to see Black and brown people in particular start to have to exit the city. But the question is even bigger than that. where do they go in the DC,
Exactly.
Maryland, and Virginia? Do they go all the way to Waldorf? Do they go all the way to Calvert? Where are they going? We don't have an opportunity to really deal with this. So now you're pushing them even not just out of the DC, but you're literally pushing them out of the DMV. And that's DC, Maryland, and Virginia. You're pushing them much, much further away. And the challenge with all of that is the resources are in DC. So if I push you away from DC in terms of resources, then I'm really sharing with you that you really don't matter. And that is discriminatory. That is prejudice. And folk may not see it like that, but if I don't put people in a position to do well, then I am not helping them.
Well, and I think the biggest part of all this is that it's alienating, it's
Sure.
humiliating,
Absolutely.
it takes away hope. And so, especially if you look at young people, I mean, you know, it's like, what's the point? But I just want to make one point because, you know, we can look at racism at the various levels. One thing that is of great concern to me, and you've heard me mention this before, Dr. Reverend Curry, is the fact that the District of Columbia has only gotten 3/5, exactly 3/5 the amount of stimulus money that every other state has gotten because we are being seen as a territory. So that's a $750 million shortfall. And I know that right now DC Council is looking at their budget and they're going to cut some of these programs. They're looking at cutting, you know, breakfast programs for kids, you know, meals. And so all of these resources, and we are lucky in the district as opposed to other jurisdictions, there are, you know, more protections than other places. Not to say that it's ideal by any means, but even that is going to get cut. And so, yeah, to me, that's something else, which, you know, I personally don't think it's coincidental that it's exactly 3/5. I don't think it's coincidental when Trump decides to have a rally on Juneteenth in Tulsa. I think that that's a big, well, I'm not going to use the language, but F you to people of color in this country. And
without question, I just want to jump in here. Without question, it is intentional. It is demonic in my understanding.
Yes.
And I will say 3/5, really? Yeah. 3/5 ought to take everybody back to the 3/5 compromise.
Exactly.
You can Google it and look it up. When white Southerners wanted to have greater representation and they compromised with Northerners to come up with this compromise that a person or a kidnapped enslaved African was only 3/5 of a person. And ironically, they come up with 3/5 of the amount of dollars that come to DC. What are they really saying to us? And then to push, as you've noted, with regard to just thumbing your nose at Juneteenth, when I'm a native Texan and I grew up understanding the significance of Juneteenth. So it is a special thing. But when you are those who believe the lie that has been told that one is superior over another, then you will minimize and you will undercut them and view them as less than a person. Indeed, African Americans or Black people and brown people are viewed as fractions of a person in terms. You can just go look at the laws. Just go look at housing treatment, look at wage theft, and look at wage disparity, look at the economic injustice. All of those things are just insanely demonic.
Well, and we didn't even have a chance to talk about redlining and how cities like Chicago had Division Street. There's so much to read. Yeah, Division, right? And different cities actually have different. In Tallahassee, Florida, where I was born, they actually had concentric circles.
Sure.
I think that in Chicago it was more like rectangles or different ways. But, you know, in closing, because I think that this has been a very rich conversation, and I hope it can be the beginning of more conversations. I think we need to educate ourselves about the history of housing in DC and what's going on so that we can better serve the community of DC. But Attorney Blair, in your closing comments, is there something that you wish that we knew better to do better by the people that we serve?
I think that this kind of programming, this kind of connection shows that we understand we need to know more and we need to get connected. You know, the legal resources we hope are there. We need to make sure that people know about them. And that's in large part, you know, making sure that we are available to others and that we go to the communities themselves too. But I hope that we can all do better in connecting and in working towards a common goal of this health justice, economic, social justice. But it's a group effort, and we hope we play some part in it.
Wow. Reverend Curry, your closing comments?
You know, more than anything else, I think we can talk about housing and tenant and landlord rights. We can talk about the whole sphere of economic injustice. We have to understand that until we have a system that allows for equity, equality, we won't be able to move forward. And I firmly believe that we are in a season now where reparations make the difference. I'm not just talking about money, although African Americans will tell you they didn't get the 40 acres and a mule. I am really talking about a systemic repair of our nation. And it's only when we get this repair of our nation that we will be able to truly say we are one nation under God, indivisible, with liberty and justice for all. Right now, we can't say that. Right now, we're finding that there is so much disparity. To talk about cockroaches on an inhaler or around something, that's atrocious in 2021 or 2020 and into 2021. We have to understand this. And it's only when the people are very serious. And the question that I leave with all of the audience is, during this season of racial consciousness erasing, do we find ourselves with the will to take the long journey so that folk have decent and affordable housing, so that they have equity on their jobs, so that they can live where they choose to live, and so that they're not measured by the content, they're measured by the content of their character and not by the color of their skin. Not as cliche, but actual fact, where we see each other as human beings and not some as animals versus those who are alive and well. And we're just asking, will we find ourselves together where all people prosper and can be in good health?
Wow, that is a wonderful way to close. And I just want to thank our wonderful guests, Dr. Reverend Curry of Pennsylvania Avenue Baptist Church and Attorney Blair of the Legal Aid Society. I mean, you have really brought a richness to this discussion. I will say that for those people who are trying to figure out what contribution they will be making to forward equity and to help quash racism, again, it's not in the huge gestures. Just bringing up these issues and talking about them amongst your various circles and saying, did you know that this is something that's happening? Where we can get a group of people who have the voices, who have the finances and the power, if you will, in the city to say, this is not acceptable. You know, we live in Ward 3, but this is not acceptable, to see what's happening in Ward 7 and 8. We are all interconnected. And so with that, the Rodham Institute would like to thank you both so much for participating. I hope that this can be the beginning of many conversations. Dr. Reverend Curry of the Pennsylvania Avenue Baptist Church, Attorney Blair from Legal Aid Society, thank you so much for what you do on a daily basis. And for any of you that have missed a portion of this webinar, please visit the Rodham Institute website where we will be posting the recording. So thank you very much and stay well, everybody.
Bye-bye. Thank you so much.
Bye.
Bye.
Thank you so much for having me.
Oh, thank you. You guys were great. Appreciate it.
Gigi.
Bye-bye.
Perfect.
Bye-bye.
Perfect.